Now let's get into resident responsibility. Okay, give me 1 second, guys. Let me just getting a text from the resident. Okay. All right. Sorry about that. All right. Okay. So resident responsibility. Here we go. So let's talk. Now I'm going to focus mainly on internal medicine. Okay. So residents are basically expected to be compassionate and work effectively as a member of the healthcare team. Okay. What do I mean by that? Okay. So it's you're you got to be professional. You got to have good conduct in patient care, and also um, your support staff. So when you get into residency, you're gonna be working with nurses, you're gonna be working with PAs, you're gonna be working with respiratory therapists, you're gonna be working with a whole host of people in the medical field. You're gonna be working with CDIs, clinical documentation, everyone. And so you can't think you're the big shot, okay? You have to learn from each specialty or each healthcare individual to support your learning. If you can get along with everyone in residency, you're going to have a great residency experience. I will tell you that right now. If you can get along with a lot of the nurses, and if you can get advice, and if they like you, they'll help you. They'll save your life actually, because because they have a lot of experience. Okay, even though you're the physician, you need to take that experience and use it. Okay, to your benefit, and you just have to respect everyone, and um, uh, and and just use everyone's help, especially your first, second year. You're gonna need everyone's help. I'll tell you that right now. Um, yeah. So because remember, you are responsible for the patient, but your attending will sign out for you after you put in the orders as well. Okay, so what are some? Let's talk about some of the responsibilities as a resident as well. Okay, so what will you? So this is more toward internal medicine, family medicine, and we'll talk about some other specialties as well. So you have to be able to assess the patient. Okay, patient is going to be coming in, okay, to your hospital. They're going to be admitted for some reason. Maybe there could be sepsis. It could be pneumonia. It could be it could be so many different things. Okay, you have to be able to initially assess it. Okay, and the thing about this is initially assessing the patient is a little bit difficulty because um, it could be anything. But what you need to do is you got to put the symptoms and your differential diagnosis together. Okay. Once you get the symptoms and you put your differential diagnosis together, it'll be a little bit easier for you down the road. And that's going to be practice. So one thing I recommend is do as much as you can. Don't do the minimums, do the maximums. Okay. Take as many patients as you can. Review as many slides as you can. Obviously, don't get overwhelmed, but you want to get enough experience. You want to do as much as you can. Okay. And the first year you're going to be pretty much going to be spending a lot of time in the hospital. Don't expect to leave early. Okay. What else you do? You're going to be performing history and physical exams. You're going to be developing an assessment for the patient. So what is that? What is a treatment plan? So basically, the assessment and impression is basically what you are thinking as their diagnosis. 54 male comes in with epigastric pain, uh, back pain that's radiating to the back. They have nausea, vomiting, fever. What is your assessment? Your assessment is pancreatitis. What is the treatment plan? Order a lipase. Order certain labs. Order a CT scan. Give them IV antibiotics. Give them IV fluids. That's what the assessment and plan is. And that will actually come with, of course, USMLE training, your medical school training, and then eventually, your residency training. Okay, performing rounds. Okay, what does that mean? So, each basically, you're going to be doing different rounds throughout the hospital in different areas. Okay. And one thing I'll say is it's good to understand the different areas of the hospital. For example, what is the ICU? What is the CCU? What is the rehab center? How do these connect? What is the clinical observation unit? Knowing the different areas of the hospitals and what to do in each area. Okay. Also, ordering tests, examination, medications, therapies. So when you get into residency, you're going to be having an EMR, okay, electronic medical record, okay, and for example, I use Epic, okay. Um, Epic is a program that is a EMR that a lot of hospitals use to find patient information and also order labs tests. So you need to be familiar with your EMR, okay, and how to order lab tests. Also, you're going to be, of course, dictating and writing notes. So dictating meaning you're using a microphone to write notes. You're going to be, typically you'll be typing all your notes. Most of the time, we don't typically write the notes because everything is electronic these days to save paper and so forth. So you'll be doing progress notes. You're gonna basically need to know the difference between an HPI, a progress note, a procedure note, a discharge summary. Okay, so you'll be doing that in internal medicine, and also you'll be also providing counseling and education to the patient. Okay, you will pretty much you're going to have to dumb down to the patient, meaning you don't need to get into technical terms whenever you're speaking to the patient. You just have to keep it basic, tell them what they have, and tell them what the next plan is. Okay, you got to explain these test results, and also you're going to be performing different procedures in internal medicine. You do vast you do NG lines. You're going to do a lumbar puncture and just so many different procedures. In pathology, you're going to be doing fine needle aspirations. In family medicine, you're going to be doing skin biopsies. Um, One recommendation is try to go to the specialty that does the most procedures. For example, if you want to learn about C-sections, go to the OBGYN people. They're more expert at it. If you want to learn about skin biopsies, maybe talk to a dermatology. You know, it'll be easier. So that's what you'll be doing. Um, the other thing is that residents must be uh, very, very competent. Okay, whenever you're doing the handover process. What do I mean by that? So, for example, let's say you worked the morning and you saw certain patients, and then you're about to hand off to your colleague that's going to be working in the evening. So you need to be competent in that. You need to understand what information you need to basically pass on to the next resident so they understand what to expect of that patient that they're going to be taking over. That's what that means. Now, the program director and faculty responsibilities. So you're going to be having a program director when you're in residency, and you're going to be having faculty when you're in residency. And these people are there to support you, but they're also there to, um, they're also there to discipline you as well. So, you need to have a good relationship with your faculty and your program director because they'll be pretty much writing your letters of recommendation for your fellowships, and they'll be promoting you so you can actually get into the fellowship you want. Now, learning and education. I wanted to kind of really talk about this because this is where the research comes in. This is where what you'll be expected to do in residency. So in residency, there's plenty of learning opportunities and also teaching opportunities. So as a resident, depending on what residency you get into and how much they focus on research. Now, pathology, they tremendously focus on research. Okay, so they want you to do one research every single year. one research project every single year. The reason for that in pathology is because for fellowship they require research. And if you want to get into a competitive fellowship in the future, you need to be able to do plenty of research that relates to that fellowship. For example, dermatopathology is a very competitive fellowship. Usually people spend many years trying to even just to get into that fellowship. I think one of the reasons is because, of course, they have a high compensatory rate, but also it's just a very kind of a good lifestyle specialty as well. In internal medicine, you'll be doing at least 2 research projects within the 3 years. And also you need to do research to get into your oncology and different fellowships as well. And then, of course, family medicine, typically, now the thing about family medicine is they don't have as many fellowships as internal medicine and pathology, so you'll probably just need to do 1 or 2 research projects. Okay. So these are some of the key research opportunity websites or organizations that you can actually read about and also get more information about. So, for example, the American College of Physicians is for internal medicine. For family medicine, it's American Academy of Family Physicians and pathology. Now, the other thing about these organizations is that they also have conferences. Okay, so I highly recommend that you attend some of these conferences whenever you're in residency, and also if you're in the U.S. If you're in the U.S. for some reason, and if you have a chance, attend these conferences. You can make a lot of connections, and it'll help you to get a residency as well. And if you can do some research early for them, that's going to be good as well. But during residency, you'll be using these organizations to get your CME credit. You'll be using it to get more information about fellowships, about practice in the future, about salaries, and just so many things. So this is just an example of some of the research that you'll be conducting. You can do a poster presentation. This is a student that actually did a poster presentation on myasthenia gravis. Okay, so you can present and also you can get your research published. And research is actually done in 3 ways. You can actually just do a poster presentation at the organization. You can also have a full article research published as well. Now, in terms of education conferences, so during residency, you'll be also be attending different conferences, because this is the thing about the conferences is it's pretty much about your learning. You'll be learning about lectures. For example, you have lectures. So, for example, in pathology, we have every single month we have a certain system that we go through. So, for example, the first month could be respiratory anatomy, or respiratory anatomy, surgical pathology, and then we also do this clinical pathology side where we talk about, for example, the test in respiratory, or even a completely different topic in clinical pathology. So it's all organized. It depends on which residency you get into. So I don't know about each different residency, what they're expected, but you typically will have conferences at least 2-3 times a week, and you're expected to attend those. If you don't attend them, you'll get points off. So very important. And it's all there to improve your education. They'll talk about research topics, they'll talk about different lectures, and they'll get into a lot of detail. Reading. So in terms of reading, um, it's actually your responsibility to actually be involved in the reading process. As a resident, you might not have enough time to read like a Harrison's or something, but you're going to have to make an effort to do it, because because it's going to help you on your board exams. Because after residency, you have to take a board exam. Depending on what residency you get into internal medicine boards. Internal medicine, you do internal. If you do family medicine, you do family medicine. You do pathology, you do pathology. So it's very important to find time for reading, and also reading on procedures as well. For example, we do a lot of fine needle aspirations, um, and so uh, it's very important to kind of get experience and reading on that. This is just something we spoke about as well. Um, this is the ACGME website where we talked about how to actually perform as a resident in terms of milestones. And these are the 6 competencies in residency that you'll be evaluated on as a resident: medical knowledge, the interpersonal skills, professionalisms, system-based practice, and also improvement. So medical knowledge is how much you know. Are you competent in your knowledge of certain diseases? Uh, interpersonal and communication skills is basically communication. Are you communicating well with your faculty, your staff? Are you giving? Are you not communicative? Are you just doing things on your own? Are you not Are you not communicating things to your attendings? Because that could be a big issue if you don't do that, and so forth. Okay, so let's get into discipline-specific education. So this is pretty much the same thing I spoke about in terms of GME and also your competency. So we can move on from this one. Teaching others. So as a resident, you will have responsibility for teaching others. So you'll be teaching medical students during residency in different realms. For example, in pathology, we actually teach. We have a teaching schedule for the medical students. So we teach them certain topics. Um, for example, the last topic I taught was renal. So, you'll have the responsibilities. It's just extra graduated responsibilities that you'll be dealing with. Um, the other thing is residents are expected to teach and mentor more junior residents and medical students and other learners whom they interact with. So when you're in the rounds, you're pretty much going to be with you're going to have a medical student that's going to be with you as well. So they will be with you. You'll be teaching them. They'll be taking the history physical exam. Um, they'll pretty much be just your. You can just say they'll be your partner. Um, and I think that's really good because if you have two heads working together, there's less likely for you to miss something as well. But you're the mentor as well. So whatever you do, they'll be looking at you. So, make sure, when you're in residency, set the right example. Don't shortcut things. Okay, now let's talk about graduated levels of responsibility. Okay, let's talk about that because as a resident, you'll be pretty much going into each level. So let's talk about that. So let's talk about some examples first. So first one's postgraduate one. So what will you be doing in PGY1? Okay, so there's going to be a lot of supervision that will be provided by the senior residents and faculty, okay, directly and indirectly, okay. Um, so the first year is going to be like the biggest learning curve you'll have, okay. For example, you'll be doing history and physical exams. You're going to be drawing blood. You're going to be starting IV lines, okay? You're going to be ordering medications, diagnostic tests, analyzing test results, okay? And also communicating to other faculty and members about those results. You're going to be placing urinary catheters, okay? You might even do some invasive procedures, okay? But your whole focus is just on, primary patient and focus of care. That's the whole goal. And your first year, your program director is going to give you a study plan. They're going to give you selected topics you need to work on. And you're just going to be understanding about the cost-effective care in medicine. That's what you're going to be doing. So you're pretty much the baby the first year, okay? But it is kind of rigorous the first year because you're still kind of getting into things. The best thing that I could say about this is just keep going with the first year. Keep pushing forward. Um, it might be a little challenging in the beginning, but just keep going forward and learn as much as you can and get the right advice. Now, second year, it's you're expected to perform independently. That's the key thing. Independence is the key thing under second year. So, for example, you're gonna still get some supervision, okay? But you're gonna be supervising the first years, okay? You are gonna be performing procedures under indirect supervision, such as inserting IV lines, central lines, arterial lines, and so forth. Now, I'm kind of more focused on internal medicine on this, but in terms of pathology, the first year you typically, are just a baby. You're just learning. The second year you're actually. I think in pathology is different because you're actually the residents aren't directly teaching you. You typically are. You're getting taught by the faculty. That's what mainly happens. The residents are teaching you about on call, but not too much about other things. But in terms of internal medicine, you will have to take a leadership role in teaching the PGY1s as a PGY2. Okay, you're going to be explaining complex diagnostic therapy procedures to the patient and family. Okay, and you're going to, of course, you're going to have to follow the ethical standards of residency as well. As a PGY3, you're pretty much going to be managing everything. Okay, so it becomes a little bit easier because you're pretty good at everything now, right? So you're basically managing and supervising the PGY1s and the PGY2s in their daily activities. So you're going to be pretty much you're kind of like an attending level, pretty much. Um, and then depends on now this depends on how they promote you and how you are. You are going to be performing complex procedures under direct supervision by the faculty. Um, and also, you're going to be, searching for um, fellowships at that time. Now, remember, internal medicine is 3 years, family medicine is 3 years, pathology is 4 years, um, and now the fourth year, it's an optional. You can actually be a fourth year resident if you want. Um, you actually can as a internal medicine, but and then the fifth year, typically that's if you want to do more research. For example, if you want to do a lot of research, you can actually do a fifth year as well. And then after that, you go to your fellowship training.